We have three members of our panel who are going to begin by leading off a discussion, and then will be joining us in the front of the room for a discussion about the morning session. And so I'm going to begin that by introducing our three panelists. Our first is Jonathan Gerber. He is the Acting Associate Director for Ecology in the National Health and Environmental Effects Research Laboratory at the US EPA. His work in this position encompasses identifying and understanding the processes that affect our health and the environment and evaluating the risks that pollution poses to humans and ecosystems. Our second panelist will be Paul Sandifer, who is the Chief Science Advisor for NOAA's National Ocean Service. He is leading a NOAA-wide effort in ecological forecasting and is co-chair of the Interagency Task Force on Integrating Science and Technology for Sustainability. Prior to going to NOAA, he had a distinguished 31-year career with the South Carolina Department of Natural Resources, including service as agency director. And our third panelist will be Ione Taylor, who serves as Associate Director for the U.S. Geological Survey Energy and Minerals and Environmental Health Mission Area, with oversight for energy and mineral resource programs, toxic hydrology, and contaminants biology programs. She joined the USGS in 1999 as Science Director for Eastern Energy Resources and has served as Deputy Regional Director and Regional Chief Scientist for the Eastern Region and as Chief Scientist for Geography. So what I'm going to do is have each of the panelists come and give some brief remarks, and then they will all come to the front for the discussion, beginning with Jonathan Gerber.
Thank you, Lynn, and thank you. This is my first presentation here. I'm delighted to be able to pick up some of the themes that were mentioned this morning. We're still going to stay at a fairly high level, but drill down with some examples, and as we move through the panel discussions, see some more examples of the progress I think that we're making from a number of perspectives, but also some of the challenges and some of the perspectives that we bring from our various locations. First, as you heard, I'm the Associate Director for Ecology for the National Health and Environmental Effects Research Laboratory. So simply in the name of that organization, you can see that the agency's mission explicitly encompasses both protecting ecosystems and human health are central part and parcel of the EPA mission, has been from the get-go. The focus on services, I think we've jumped into this a little bit behind the curve, but if not, completely up to our necks in it, we're currently, at least ankle deep in moving that forward, and that is supported by both the regulatory and science arms of the agency. Folks tend to associate EPA with its regulatory arm. We talked a lot about public perception, but it's important to realize it is also a science agency, and the science arm in particular is leading the charge for us into the area of ecosystem services. And this is a ongoing and continuing area of focus and investment, particularly in the research side, but more and more with the regulatory arms of the agency. Yeah, I had to note about the usual disclaimers. My boss is in the room, so Hal will make sure that that's true, that these are my views, not necessarily reflecting the total view of the agency, because I'm going to give some perspectives and maybe do some editorializing. We talked a little bit this morning about the environmental ethic that underlies where we're going in this area, and certainly from the mission-driven perspective of the Environmental Protection Agency, it's important to realize that a lot of our marching orders come from that range of national policies incorporated into statutes that reflected a lot of the country's environmental ethics in the 60s and 70s. And so those actions that we carry out under these mandates of the Clean Water Act, this is particularly with respect to water and coastal waters and marine waters to the degree that the agency is involved in those, flow from a series of statutes. And those statutes reflect that public perception of where we stand with respect to how we as a nation value these services. And those are captured in these national mandates. And a bit of editorializing, we heard about how that ethic may need to change in future. That's probably going to be reflected in these types of laws as we move forward. We've put forward as you've seen a lot of frameworks for how we link services to human well-being in the context of this workshop. And here on this panel, we've put together the beginnings of an additional framework which we hope will stimulate discussion, in which we're moving here on the left side of the screen from the stressors to those points where we have management decisions and a number of places where we have the ability to intervene in the delivery of those services as they affect these services. We've heard, and we will continue to hear more about the various services here that we hope have a direct or indirect, but outcome in terms of human well-being, and then importantly understanding that there are feedbacks in which this is reflected back on how we perceive these stressors. We heard that this morning with respect to fish contamination in the Gulf, that there is a direct link between the perception of these things and what we do about them. And I mentioned this to Holly just recently, that we have a real issue here with shifting baselines and what people expect to see. The comment about hiking and the number of people hiking has a lot to do with the shifting baseline as we perceive what these ecosystems are providing us and what we expect. And the underlying fundamental question for the workshop here is how we optimize our interventions in order to maximize the production of services which will have a positive impact on well-being. So in essence, the workshop is really focused on making these connections, making them real, establishing them in a way that will lead us forward in terms of policy and actions. And in a simple-minded way, I put together a very high-level critical path of how we might structure and move through this, the way I would think about it as a box and arrow kind of systems ecology. And the first is we need to establish the inventories of baseline ecosystem and health conditions. And as we move through this, you'll see at the end, I'll tie this back and say, how are we doing here? And I'll give some examples, at least from my perspective, of examples of this. The second step is those translation functions, how you convert those conditions into quantifiable services. We heard that introduced this morning. It's an area of ongoing work. It's going to continue, and we'll see a little bit about how we're moving there. And then we also heard this mention that how we link these services to human health outcomes. Now, you know, I mentioned that I'm in a research organization that conducts both human health and ecosystem and ecological research. And it's a bit of an oversimplification, but my perspective is that the human health work focuses to a very, very large degree on the effects of chemicals on human beings. And that's the purview of the human health sort of arena in which many of you are involved. And then there's the effects of everything else on everything else, and that's the eco part. And that's the part I'm involved in. Anyway, so we've got that kind of cultural divide that we still need to bridge even within our own organization. And then the really next phase is how we model and predict the impacts of our interventions and feedbacks to complete that cycle. So in a very simple, high-level way, that's the structure of a framework that we might use. And I want to walk through this again, sort of starting over on the left with an example of how we're doing with respect to assessing the condition of stressors and the responses in marine systems. And we have been involved in a whole series of monitoring and assessment activities since the early 1990s, which have led to the creation of these national coastal condition assessments. And they represent, I think, our flagship programs for putting together a comprehensive assessment of the condition of our coastal ecosystems. And that this started as a research enterprise back in the 90s in a statistically defensible way to answer the sort of good news, bad news observation, which is that we think we know a lot about the condition of our coastal ecosystems with respect to the regulatory programs that we've put in place under the Clean Water Act and other acts. That's the good news. The bad news is we couldn't prove it. And so how we would go about proving that sort of led to the impetus of these programs, and there are a whole series of these condition reports that have emerged from that. You can see them here. They're all available online. These are the National Coastal Condition Reports that contain, I think, the best assessments of coastal condition that we currently have available to us. Obviously, this wasn't an EPA alone. There were multiple partners involved in this, and it is a summary of a tremendous amount of information and data. They put together a summary of monitoring data from both the internal EPA networks and the other networks by NOAA and other agencies. These assessments have evolved over the last 20 years, now include all of the coterminous U.S. Coastal waters, particularly estuaries, but now reaching out onto the continental shelves, and some of the territories and states that are not coterminous, and that's all included in these reports. Now, the reports are based on indicators, and this is the condition part of this. And for those of us in the business, these are sort of rounding up the usual suspects. These are the indicators that we would look for that provide a good insight into water quality, the sediment quality, the communities that live in the sediments, some of the fish tissue work that has to do with contaminants in the fish. We heard about that this morning from Puget Sound as another snapshot of that. And then some work that includes coastal habitats. Now, as a result of this, we can put together a series of assessment reports that give these kind of indicator summaries from the national level and down into the regional level. And whether you agree with the indicators or the colors or not, the type of information that's available leads you to be able to do this type of assessment at the national level, so you can come up with numbers like the overall condition for U.S. coastal waters is fair. Okay, there's a qualitative assessment based on all these data as they're round through, and you can get these snapshots for the different regions around the coast for those major categories that are then indexed and put together. You can drill down with these data to regional and even site-specific to look at whether your particular area or a particular area of interest sort of comes out red, yellow, or green. We can argue about all those things, but the data are there and available with this type of resolution. Now, the main focus of the coastal condition reports, as I said, was near shore. That's estuaries, bays, and very limited offshore, but it's now been extended to the continental shelf with NOAA's program that uses many of the same indices and the same indicators. We're going to hear a lot about fisheries. I'm not going to get into the details of this, but the fisheries data are included here. We're going to hear a lot more about that. Here are some of the fisheries reports for some of the major fish stocks in terms of landings that haven't completely tanked. There's a whole other story, of course, behind that. We heard a little bit about fish consumption advisories. There are over 100 fish consumption advisories around the country. They can be displayed in this type of format, linked mostly to contaminants again. Most of the fish advisories have to do with chemicals, at least chemical concerns with PCBs, mercury, dioxin, and even DDT, leading to these types of fish advisories. So that gave you a flavor a little bit for where we stand with in terms of our ability to assess condition. If we sort of move through this conceptual diagram to the right, we get here, it says, well, how do you translate those into services? And this morning, Lydia did a great job sort of laying out various tools that are available, some are qualitative, some are more quantitative. She mentioned the National Services Atlas. I just wanted to give you a little flavor for that. As part of this, the National Environmental Services Atlas for Sustainability is meant to be a web-based tool which is geographically referenced that allows you to look at the distribution of services. Yeah, I should mention that if you haven't, jump in. I don't mind being interrupted. If there are questions, just jump in and welcome. Okay. But if something's not clear, be sure to just jump in. I don't mind at all. To look at the distribution of these services, many of which Lydia mentioned this morning, geographically referenced, and you can pull up maps for regions of interest. Many of the questions that are underlying this atlas are very, very similar to what we heard presented this morning. Again, I think we're all moving down the same road towards this bottom line of how can we demonstrate how these services explicitly relate to human health and well-being. So we're very much moving down the same path with regard to that. Here's a screenshot from the atlas, which allows you then, with this geographically based data, to jump to a region of interest, examine with these checkboxes what you're interested in, and they will be displayed. This is not live yet, but this is coming out in 2013, I believe, and it'll go live at least in a beta kind of format. So all online. Again, there are multiple partners involved in this. There is an additional aspect of this called the EcoHealth Browser, which allows you to then display the relationships in this type of DAISY format, in which clicking on any one of these will bring up descriptions and also the underlying papers and references. This one, so you could click on any one of these or hover over any one of these relationships between, say, forest, water regulation, human health, mental health, and if there are data and there are papers, they will automatically appear, and the degree to which we have information will be displayed. So again, capturing all of this in a synthetic way is the way the browser is working. So we're sort of moving now a little bit farther over towards linking those assessments to human health. Not all the way there. Another shot of the browser that if you were, in this case, looking at wetlands, there would be various relationships, water regulation, for example, or any of the others that might be related there. The references and key studies would be listed at the bottom. You could hover over any one of these, and it would pull up a description of that. So that's another tool at a little more depth. So just to sum up, as we move through that diagram, sort of where I think we've come is that in terms of establishing inventories of baseline condition, ecological and human health condition, I think we're doing pretty well. I think that many of those indicators and much of that display, certainly within my career, starting back in the 70s has moved along quite well in terms of our ability to monitor and assess many of these important baseline things. Translating those into quantifiable services, I think you've heard and you'll continue to hear, is that we're making considerable progress. I know in our agency, as I mentioned, we jumped into this a little late. Many of the NGOs and academics have been making great progress here, and I think that's going to continue. Now, linking those services to human health outcomes, topic of this particular workshop, my perspective is that we're really just getting started in terms of quantifying and modeling those, and that being able to predict the impacts of those regulatory or non-regulatory cultural interventions, direct and indirect, on feedback, and those, particularly those feedbacks, also, I would say, still needs a tremendous amount of work. So, that wraps up my part, and I think we're going to take questions at the